is really very, very important. Otherwise, we won't have the results. And for outpatients, it's difficult. I understand that. I mean, in a group, the whole village knows, oh, that's another Wittlinger patient when they come around with their bandages and they carry it around, yes, and it's just the normal thing in our village. But when they live at home, everybody asks them, and there are so many things they don't want to say. And then we have to explain it to them. And it's really different. And we have to be diplomatic. We have to try to convince them. And I just want to tell you one example. It was a primary edema, a Spanish lady, and she came with both legs, and she was 45. And it just had occurred that she got this swelling, and they were heavy. I was not at home, and her English was rather bad, and so she said simply, no, bandage, no. And then I came home and said, well, I speak Spanish, and she said, please try to convince her. It is necessary. I looked at her legs, and I said, yes, we have to bandage. No. I first had asked her, when did it start? How did it start? And because having an edema, lymphedema with 45 is not very usual. And so I asked her whether she went for a long walk, or I don't know what I had asked her. And she said, no. And finally I said, oh, I knew the Spaniards, they like to go to Cuba. I said, maybe you have a long flight. See. And I said, and then you went to Cuba, and when you left the plane and you saw your legs, they were swollen. Yes. And then you thought this will go back. I never in my life had swollen legs. Yes. And then you went to the ocean, and the waves came, and you thought this helps, and it makes it worse, and you had to go back to Spain. Yes. And then it was even worse. And now you are here. Why do you tell me all these things when you know it? I said, well, I wanted to tell you more or less that I can imagine how you felt. You cannot. I said, okay, maybe I cannot. I said, but you need to be bandaged. No. I said, let's make a deal. I said, let me 3 days, allow me to bandage you. If you do not see the difference from the 3 days first and the 3 days with bandage, you must not have any bandage any longer. She said, 3 days, a deal. I said, yes. Okay. I went upstairs to the therapy department and said, when she next day comes, squeeze her. Of course, we wanted to have results, and on the legs, it's not that bad. And if she says I shouldn't hurt, you know, but if she feels a little uncomfortable, make her walk a little bit or stand on the toes, and so move. And then this feeling disappears. I had to wait 3 days. The second day she came, oh, Mrs. Wittlinger. Yeah, and then she had the rest of the days, she had her bandage. Yeah. When does it make sense? It does not always make sense. There are cases where we cannot put a bandage on. There are cases like pain or open wounds or paralyzed, and therefore we cannot say as a standard we always bandage. No. As Dr. Schmidt told you, there were some cases where we did MLD and no bandage, and these were cases we could not bandage, you know. And that makes sense. And it makes sense that we apply the correct bandage to this the right way. And of course it is on the knuckles it is firmer, and then when it comes up it is lighter, or here we have the firmest pressure here, and then it gets big. But also fibrosis means this is a hard, it can be an area only, or it can be circular around, and it's awful. But you cannot move when you put your fingers on your tissue or your skin, so you can move it against the layer below, which is the fascia or the fascia. So when you have a fibrosis, no, it's simply hard. And bandaging does soften this fibrosis, besides what we do with our hands. And also Dr. Schmidt was the electrotherapy mentioning, and this especially, it's a special one which does deep as oscillations. It's called Hivamad. I think you can get it here as well. It's really great, and it softens the tissue. So when we feel that, and our doctors diagnose perfectly, and this is easy then for us, we know we have to find out where is there a fibrotic area. We are told, but you, without patients and without maybe a medical doctor who understands a lot of lymphedema, have to make your own assessment, and this is palpating the edema and finding out where are hard tissues and where is fibrosis. And this really is softening fibrosis, and immediately we do MLD besides, and bandaging helps to soften fibrosis. And of course to increase lymph flow. I mentioned this already, because we compress so that the valves close, and then of course the liquid which goes from puts it here from the hands up to here, and then we put it of course into areas where it's working, so it's increasing lymph flow. And not only that, I mentioned earlier that veins have valves as well, because the pressure in the veins would not be high enough that the blood from our toes would come up to the groin area. Impossible. The gravity would be too much. So there are valves, then the pressure is interrupted, and the venous blood can flow back. Now, treatment of lymphedema is split into two phases. We have the decongesting phase, that is for inpatients, and our patients, they stay with us 3 weeks, and they get every day one treatment from Monday to Friday, and Saturday they have, if they need it, they get another treatment, but they are bandaged and have gymnastic. And bandaging, of course, always. There is no way out. Everybody who has to have a bandage is bandaged. And then we do respiratory, also therapy with them. Kinesis exercises is also important. They have to move, because when you see the bandage is sitting on the skin, and between skin and the muscles, there is tissue as well. And when the muscles is contracted, it becomes small and thick, and then presses against the bandage and is compressing the lymph vessels as well, and so stimulating to contract. Very important thing. And skincare. Both bandaging or bandages and the garments are drying our skin. You have to tell your patients, or those among you who are patients, you have to really do a good skin care. This is normal. Your skin is suffering from both. The decongesting phase is 3 weeks or 4 weeks, or sometimes 6 weeks, depending on the heaviness of the case. And then we send them back to their therapist, and then they get also a recommendation from our doctors for their family doctor, that he knows what we did and what happened with the patient and what the recommendation of the specialist is. And so this is then MLD, manual lymph drainage, 1 to 3 times per week, or whatever is possible. And then the compression garment, very important. I don't dare to say don't buy it over the, how do you say, over the counter. There are so many, but I really don't